And then in terms of the types of fillers that you use, do you have like a range of different ones that you just pick and choose, or do you kind of stick to certain main fillers in your practice?
I stick mainly with the Restylane line of fillers, and I do use Radiesse
Okay.
also. So I would say those are the main ones that I use. When I opened my practice, I had to make a choice of what I wanted to stock and what I wanted to have available. And it is definitely, it's hard to have every single filler. There's probably 20 out there available. So I went with the Restylane line because I personally really just there's some of those products I really love, and they've always been consistent for me.
Yeah.
And so I use mainly Restylane. I think that both, like, all the companies have a wide range of fillers and products to use in different locations.
Hmm.
So what I do is, what I tell my patients is that, tell me what area you like, what do you want to work on, and I'll make the choice
Yeah.
of which filler to use. There are all the fillers have such different qualities that, yeah, I definitely have I have my favorites for certain areas, I suppose.
So for cheeks, what do you prefer?
I like Lift. The
Okay. And then
Yeah.
for lips?
My go-to would be like a half syringe of Restylane, which to
Hmm.
me is just enough to give someone a boost, but not change change anything about the overall look of the lips, just
Yeah.
define. I've had the pleasure of using Restylane Kiss, the new one.
Oh, I was going to ask you
And
about that one. Yeah.
yeah, I actually, so I've got that in stock now. And I have to
Yeah.
say,
What do
like,
you think?
I really like it.
Mhm.
So the way they describe it is that Kiss is in that same family with Refine and Define.
Hmm. Hmm.
So it's the sort of newer technology. It incorporates with the skin a lot better, and it's a little
Expression.
softer,
Right?
the expression
Yeah.
technology. And it's sort of in between, regarding like G prime. It's in between Refine and Define.
Okay.
So you can inject it superficially without seeing lumps or with the
Hmm.
filler.
Yeah.
But it's, in a way, because it has a little bit more hold than like Restylane Refine, you can use less, and you need less to give.
Oh, okay. But
So
does it
what I
still come
let
with like a 1 cc or?
it comes in a 1 cc. I don't know, as far as I know, that's the only size. But what I like is, think about, like, if you're going to use Refine, sometimes you're using like almost 1 cc, maybe in the lips. With Kiss, you might use
Yeah.
0.75, and then you have a little left over to maybe put in the nasolabial or the marionettes or the perioral lines, so that it might give you a little more wiggle
Yeah.
room on that regard.
Yeah.
It
No, for sure.
lasts,
And
yeah.
then Kiss, I read it's supposed to last longer. Are you finding that?
They said it's supposed to last a year. I don't know yet. I think that the newer expression, that expression technology, it could last longer. I think it does last longer, but I don't know. Personal experience wise, obviously, I've only
Yeah,
just
I've
started
just been
using it.
using. Yeah, no, I mean, you and I are alike. I also just stock Restylane products, and I use Silk in the lips, and I've
Okay.
been overall pretty happy with it. I mean, when I'm done injecting, there's always a little bit of lumpiness, always. And I tell people that it's going to smooth out, and it always smooths out, within, I would say, a week. I inject superficially, so there's no concern for intramuscular, issues. But yeah, I don't know. Maybe with the Kiss, it's going to be like a smoother type of appearance from the get-go. I also tell people just kind of to massage the area, and it tends to kind of be, not an issue. But yeah, of course, it never lasts a year. I mean, Silk, will last maybe 6 months tops, for the most part.